So in the case of patients who have spinal stenosis, generally caused by a bone spur or a disc that's coming from the anterior aspect of their neck, you may be a candidate for what's called an anterior cervical decompression fusion. Anterior cervical decompression fusion would only be offered after having long-standing pain or severe weakness or severe and rapidly progressing pain that's known to be caused by a disc in your neck, confirmed on MRI. Once you've been deemed appropriate for surgery, that is, either conservative or non-surgical management has been ruled out or already done and failed, you would then be potentially a candidate for anterior cervical decompression fusion. In an anterior cervical decompression fusion, we make an incision on the front of your neck and very carefully maneuver between the muscles, the trachea, the esophagus, and the very important vessels in your neck, and go down to the anterior aspect of your spinal cord. We remove your disc, and with the use of a neurosurgical microscope, can view the spinal cord to be sure that the nerves are completely decompressed and that all bone spurs have been removed. We now have to stabilize your spine, and we do this by placing an implant in between those two bones and allow those two bones to grow together. Typically, a small plate is placed across these vertebral bodies to help stabilize that implant and allow it to fuse or grow together. It's very unusual to have more than a 1 or 2 level fusion. And although there is some limitation of mobility by fusing your neck, interestingly, most patients actually will notice an improvement in their motion because their pain is so much better that they lost more motion from the pain than they do from the fusion. The fusion generally takes a few weeks to initiate and can take a few months to be complete. It takes longer in people who smoke or have other medical factors, but generally speaking, the nerve pain or the arm pain in most cases is gone nearly immediately, unless the nerve is permanently damaged. If you have long-standing radiculopathy, which is in another video, that is pain shooting from your neck down to your arm, and you've failed conservative treatments, you may be a candidate for the very successful anterior cervical decompression fusion.